In this webinar, we will learn the concept of barrier nursing. Patients with infections are commonly admitted in hospitals, who become a potential source of infections for the other non-infective patients as well as for the healthcare providers. The universal precautions are followed in these situations so as to prevent the spread of infections in the unit. However, there are some situations where we need to take more stringent measures to prevent spread of infections than just routine universal precautions. These situations include highly contagious infections, for example neonatal diarrhea, or neonates with suspected or proven H1N1 infections, and neonates with multi-drug resistant infections. On the contrary, an uninfected neonate with very immature immune system, for example with severe neutropenia, is vulnerable to acquire infections from the healthcare professionals or environment, and thus also needs extra precaution. The set of interventions consisting of stringent infection control practices so as to prevent spread of infections in such situations is referred to as barrier nursing. In this webinar, we will learn the concept of barrier nursing, universal precautions, contact prevention, use of personal protective equipment, and respiratory preventions. What is the concept of barrier nursing? It is a set of interventions consisting of stringent infection control practices used during nursing the neonate so as to prevent the spread of infection from one neonate to another as well as to the healthcare staff. The spread of infection occurs in different ways, which include contact with contaminated surfaces or hands, fomites, droplets, inhaling aerosols, etc. The aim of the barrier nursing is to prevent horizontal transmission of infection in special care newborn units, that is from one baby to another, protection of the medical staff against infection from patients, and prevention of spread of infections outside the unit and hospital's boundary. Universal precautions are the standard precautions exercised during routine nursing care of neonates so that they do not acquire infection from healthcare professionals, other neonates, or fomites. As many neonates with blood-borne infections are unrecognized at admission, every neonate should be considered as potentially infectious, and the universal precautions are undertaken irrespective of the presumed infection status of the neonate. Universal precautions includes hand hygiene, use of gloves, gowns, masks during the handling patient body fluids, prevention of fomites, and disinfections of anything which comes in contact with the baby. Fomites play a very important role in horizontal transmission of infection. Common fomites in special care newborn units include items related to day-to-day nursing care such as stethoscopes, thermometer, inch tape, etc. Each bed should have an individual stethoscope, thermometer, inch tape included in the nursing tray, which also includes spirit and betadine swabs. The sharing of such items between neonates must be strictly prohibited. If one or more baby with resistant organisms is identified in SNCU, then such patient should be given special attention. Universal precaution should be strengthened. Such neonates should be cohorted away from the rest of the neonates, for example, in the isolation room. If possible, the nurse looking after such neonates should be separate, who should not be involved in the care of rest of the neonates. Appropriate personal protective equipments, that is gloves, gowns or masks used for such a neonate should be separate. Their biomedical waste disposal should also be separate. The body secretions and excreta, that is saliva, blood, urine, feces, wound drainage and other body fluids should be handled after donning appropriate personal protective equipments, regardless of their infection status. These should be discarded in yellow bin for biomedical waste disposal. However, if the body secretions or excreta are considered highly contagious, for example, during the episodes of diarrhea, the personal protective equipments should be worn and discarded in a special way as discussed subsequently. These equipment should be worn in such a way that the entire body of the healthcare professional should be covered and no body secretion should come in direct contact with the healthcare professional. The step-by-step details of these procedures are available in job aids. All items of personal protective equipment should be discarded after handling the neonate, and hand hygiene should be performed in the end. Each neonate requires separate personal protective equipment during such periods. Care must be taken to ensure separate biomedical waste disposal of such patients. The purpose of personal protective equipment is to prevent exposure of healthcare professionals with highly contagious body fluids of the patient. Personal protective equipment should be worn in particular sequence, that is, gown first, followed by mask or respirator, then goggles or face shield, and in the end gloves. First, appropriate sized gown with opening in the back is worn. The neck and the waist are secured. Then wear mask covering nose, mouth and chin. Wear goggles and or face shield wherever appropriate if there is risk of droplet spread to these areas. Don gloves in the end such that the gloves extend over the cuffs of gown. After handling the baby, the personal protective equipment should be removed in a particular sequence. First gloves, followed by face shield or goggles, then gown and mask or respirator in the end. The outer front side of personal protective equipment should all be considered contaminated while removal. For removal of gloves, first grasp outside edge of the left glove near the wrist and peel it away from the hand, turning the glove inside out. Now hold this glove in the right gloved hand. Slide the ungloved index finger of the left hand under the wrist hand of right glove and peel it off inside out, creating a bag of both the gloves. Discard them in yellow bin. For removing goggles or face shield, grasp their rear end and lift them away from the face. For removing the gown, unfasten ties, peel it away from the neck and shoulder and start rolling it in such a way that the contaminated outside of the gown becomes inner side of the roll. Discard the fully rolled gown in the yellow bin. In the end, untie the bottom tie followed by the top tie to release the mask from the face and discard. In a similar manner, remove the respirator by first lifting the bottom elastic followed by the top elastic. Perform hand hygiene in the end. Airborne precautions are designed for preventing infections which have a risk of airborne transmissions of infective agents. This occurs by either small particle airborne droplets residue, which are 5 micrometer or smaller in size. Because of their smaller size, they remain suspended in the air for long periods or ride in the dust particles. Microorganisms carried in this manner may disperse to far off places. Therefore, respiratory precautions require special air handling and negative pressure ventilations of the room to prevent airborne transmissions. However, generally such facilities are not available even in bigger hospitals. If such facilities is not available in our hospital, then nearby hospitals should be contacted for such a patient. To summarize, in this webinar we have learned about barrier nursing is an effective way of infection spread within the special care newborn unit. Universal precautions should be exercised during usual SNCU care. In case of neonates with highly contagious infections, appropriate personal protective equipment should be worn in addition. A particular sequence of donning and removal of personal protective equipment must be adhered to. Respiratory isolation is required for infections with the risk of airborne transmission. Thank you.